Welcome to another in the series, The Sip and the Chat. Welcome to another in the series, Sip and the Chat. I'm your host, LELEITH TOMLINSON. At Sip and Chat, we seek to empower, energize, and most of all, we want to make sure that we leave you with information to make you a better person. Sometimes we're just existing and not being mindful of so many things that concerns our health or our wealth, and we just go about every day as business as usual. But today we want to talk about a very topical issue that has basically been at the forefront of our mind since the month of October and even coming into the month of November. And during the month of October, it was recognized as Cancer Awareness Month with more emphasis on breast cancer. So you would have seen a lot of persons going about with their little pink emblems, and you would have seen persons talking about the pink run, which I did sign up for as well. And a lot of activities, corporations decorated, adorned offices with pink and white, and it was just very pervasive, the whole issue and awareness of breast cancer, in particular breast cancer. Well, today we have in our studios a miracle lady, I would call her. We had a pre-discussion, so that's why I'm promising my discussion on that. I have with me today Miss Paulette,
Yes, ma'am.
a true survivor of this, what we would refer to as a dreaded disease. I mean, it's so dreaded that not many persons even want to call it. When they're diagnosed, they call it the big C.
Yeah.
So first of all, let me welcome you, Miss Paulette. Welcome to Sip and Chat.
Great afternoon. It's a pleasure being here.
Right. One of the things I must say before I go any further with Miss Paulette is that I just admire her level of optimism. Now let us just get into some facts about breast cancer. Breast cancer affects not only women but also men. Our research says to us that in the United States, over 370,000 persons, 720 persons were diagnosed or they had new cases of breast cancer, and in that was also men. So first of all, Ms. Paulette, one of the things that we want to ask you, first of all, is how did you become aware that something was wrong with you before you get to saying it was what it was diagnosed?
All right. So for me, it was just like a typical day.
Mm-hmm.
And felt this lump, didn't take notice of it as I should, because what happened is that it was playing like mind tricks on me. So I would feel it today, then it gone next week, then it comes back again.
Okay.
But as I said before, never take it to notice to say, all right, then is something wrong.
Mm-hmm.
So when I realized now that this seems to be a very deep thing, is that I started wearing different colors bra, and then I would see different kind of signs in the brassiere.
Like spottings.
Blood, like when you have a cut on your feet and maybe you squeeze it and see that yellow thing come up.
Okay.
Right,
okay.
And they call it pus. All right, so that's what happened to me. Even to that time when I saw it, you just hear the word, you just see the thing, and then you're wondering to yourself, what is this? So whenever time I try to remove the bra, it would get very sticky to the breast.
Because there's something oozing from the breast.
Exactly. And then being the curious person that I am, I would always smell the bra. Then I didn't like what I was smelling. So I have a bigger sister that lives in Venezuela. She was in Jamaica at the time, and I bring it across to her, and she said to me that something is wrong. Might I just say, my bigger sister is a 37-year breast cancer survivor at the time, because she lives with it for 37 years. So when after explaining everything to her and letting her know what happened to me, I was working at a particular place, and I had to use a stick to pull down a particular item to serve my customer. And then I started feeling pain in the armpits. And I said, no,
something
is
wrong.
yes. So I begged a little time from my manager at the time, and I asked permission to call the sister again and speak to her, knowing that she's so educated. Because remember now, you're talking about a 37-year survivor that comes out of breast cancer, liver cancer, lung cancer, stomach cancer, and uterus.
Uterine cancer.
That's right. She said, whatever you're doing, you have to stop. Go to the doctor. I just want to make it be known. I've been visiting the Cancer Society for years, doing my mammograms and all of that. And they didn't pick it up. When I spoke to my sister, she said, you have to go. So I went to Chris Radiology, did an ultrasound. You know, the ultrasound would normally take a few days to get your results. So went back to work, doing my daily job, and, Vivacious and, full and Brivant and all of that. When I went there, a couple of days after I got the result, and the doctor said to me, what are you doing, Miss Beckford? I said, I'm okay, I'm doing good. And she said to me, calling from Chris Radiology. And she said, I have the results from your test. I realized that the doctor paused in when he was speaking to me. I said to him, Doc, it's okay, I can take it. And he said to me that the result came back and it's cancer. No, when we hear the word cancer, I didn't even try to.
You don't even if you swallow.
That's right.
You blink.
Exactly.
Right.
Because what I want to do for myself is, when you hear the word cancer, a lot of persons, they just succumb to themselves, and for them it's death. I went home and I called my family and I spoke to them about it. I knew that some of them didn't take it very good at the time. So what I did, I called a house meeting and I explained to everybody about it. After explaining to them about it, one of the first things one of my nieces said to me, boy, auntie, you ever dead? So I said, no.
Because that's what we call it, right?
That's right,
we call it
the disease.
Exactly.
So I said, no. So what I did is that I try my best to compose myself, and then I spoke to my pastor about it. At the time, he was Pastor Courtney McLean, now Apostle Dr. Courtney McLean. And we spoke about it. And he's a man of prophecy.
Prayer.
Trust me, a really, really true man of God. And at the time, we were dealing with intercessors. And I have an awesome woman, Reverend Atkins Bulldozer. Yeah. She was my...
She sounded like she can bulldoze some things.
She was a prayer warrior. And we prayed, and we prayed. Might I just say, after doing that, then I started to seek advice, started to seek the best doctors. I had up to 3 doctors at the time, because I wanted to get the best result for me, knowing that I have to survive this disease. So I started with one. First, I went to Medical Associates, and after I did all my tests and everything came back, he said to me that I have something called intrastic conductive papillary carcinoma.
Oh, Lord Jesus.
Yes. No, when I hear the big words, I not understand some of the big words. So I say, what, Paulette, draw for Google. And being as my sister is so medical in all the fields, because she's been through it all, she said, Paulette, it's cancer. She said, anywhere you hear the word carcinoma, it's cancer. And then, after hearing that, now it's my turn to start to deal with the process. And my process consists of going to the doctors, doing the doctor's visit. I do every test, from bone test, CT scan, full body scan, you name it. All the tests that you can think of. ECG, all of them. Then I was appointed to a doctor in New Kingston by the name of Dr. Seymour Mullins. Awesome man of God too. Awesome, awesome man of God. And then that's where it all begins. First, I had to do my blood. He said to me, Paulette, you have to do your blood test to know what type you are. And a lot of persons have been going through cancer. A lot of persons have been taking a lot of things, doing a lot of things, but guess what? We are what we eat. Secondly, if you don't know your blood type, you might just be contributing the wrong thing to your system. So, there was a drastic diet change for me. All the beautiful things that I love, all the nice things that I used to eat, not anymore. So I started to doing my colon cleanse, my liver cleanse, all of the above. And he turned and he said to me that I'm going to put you on to Huey. And I said, why? He said that they're going to be doing another surgery. And I said, okay. When I went to Huey, I met some awesome doctors, from Dr. Hilary Brown to Dr. Carlos Martin. He is the one that predicted that I had only 6 months left to live if I didn't do what I have to do. But when you get a thing like cancer, I mean, you're not, feel the vivacious there again and the upbeat because you're thinking to yourself, what is next? So follow the doctor's instructions, do what they said I was supposed to do. But one of the greatest things was that everything that they said to do, I did the opposite. Because what I realized is that what is good for you is not good for me. That is how the blood count came in. Started visiting the UWI, started doing everything that I know I had was to do until the day of my surgery. When I went to UWI and met Dr. Hilary Brown and she saw me, she said to me, when I saw you came to the door, I was looking at my daughter. Because let me tell you something, the support is what you need when you're going through things like these. I have to big up my family. They were there.
You can call somebody names.
Yes, I have to big up my family. Well, one of my nieces here with me, Anika, and some of the times your family not take the news too good, because sometimes they make you feel like you want to pass out.
That's so understandable as well.
Yes. They make you feel like you have a pass out.
Right.
So saying it to them was one of the biggest things that I could have ever done, because as I said before, I got the support from my church family and I got the support from my immediate biological family. And that was good for me. The day of my surgery, my God.
So this was the first time now that you are going to be doing this invasive process.
That's right. Because remember now, I had 3 doctors. One wanted me to take out the lump. I did that at Medical Associate. After doing that surgery at Medical Associate, when other tests came back, it is showing that there are still cells. That's right. So when I get hooked onto you, and started doing all my other tests, they're saying to me that the breast has to be removed. That is when everything boils down to, you have to say to yourself, say, all right, you came in this world and you came full speed ahead. Everything, eyes, hands, feet, you're all intact. You're a perfect woman or a complete woman, then put it that way. But there you go, something went wrong and then you have to do something. Did my surgery. When I went to the hospital, I was the youngest person on the ward at that time. Might I just say I'm going 11 years, 11 full years and still going strong. And I'm cancer free.
Praise
Hallelujah.
God.
All right, so after doing that and all of that, did my surgery. I was the youngest person on the ward coming in. Still never feel no fear yet, until when the doctor said to me that you have to give blood. And I'm saying to myself, blood? No, sir. We have to go give blood. Called my sister again that was living in Venezuela. She said, Paulette, go and give the blood. God forbid if you don't give that blood and something should happen to you on that table, the blood is not going to be administered to you. I went ahead, still didn't cry up to this moment, I still didn't cry because I had to compose myself. I had to find the strength in myself. Faith without work is dead, right? And everything that we do, wisdom, knowledge, and understanding. All right. So when I went in and did my surgery and everything, I came out. I mean, a bunch of doctors were surrounding Paulette. Bunch of doctors were surrounding me. And when I did my surgery and came out, came on the ward, let me tell you something, people of God. That is when I started to feel myself and say, yes, man, this thing was real. Because to tell you the truth, I didn't stress, I didn't worry. I just tried to stay around persons that are very positive. Because what a lot of persons don't understand is that when you are going through cancer or any form of sickness, You need to be around people that are positive
Yes,
and
fueling
can
you with
breathe
positive energy.
positive energy in your life. So I tried to stay away from everybody that was negative. Some of my family members I really didn't want there because they were so weak. Because the first
Which is
thing,
understandable
which is
too.
understandable, but the thing about it is that some of them were, as you see them, you see the tears, and I
Right.
didn't want that.
Right.
I have to be strong for myself. So after doing all of that, I did my surgery, came home, started to do my recuperation, started to go back to the doctor to do my regular visit, and I went to look for the very famous doctor that told me that I would have been for 6 months. So every time that I go to the doctor, I would say, "Hi, Carlos Martin, remember Paulette?" He said, "I remember you gave me 6 months." And when that doctor see me, let me tell you something, that doctor can't believe me. I am cancer free. I am cancer free. I used to be on medications for 5 years and it increased to 10. I've completed that 10 years and I'm now living cancer free.
Wow. Wow.
I just want to let somebody know today that cancer is not a death sentence. A lot of us look at this and say, okay, it's a death sentence. It's not. Stress is not good for you. And that is what kills you. There is hope. There is life after cancer. When I took off the breast, I wasn't thinking about, oh, how would I look? Or what would I look like? Or I wouldn't get married or I wouldn't find love again or anything like that. No, I was thinking about my life, living for that moment, living so that I can able to come back and testify to somebody and tell them that what the Lord has done for me and I have come from cancer to a survivor. So I thrive and I survive.
Wow.
And here I am today, and I just want to be a living testimony to those who are going through right now and think to themselves that, listen, I'm not going to make it. I'm not going to live. I just want to say, cancer is real. It's hereditary in my family. I lost my sister and I lost my brother in COVID. My brother lost his life of colon cancer. And my biggest sister, one of my biggest motivator, she struggled for 37 years with it. She went down to hospice at her home and then she lost her life. But within that time, she never, ever, ever, ever wavered because she knew that living with the cancer and someday she was going to die, but she lived one of her best life. She lived the life of God. She served, and that was the outcome for her.
Right. So, wow, I want to really, really thank Paulette for sharing so much just about her story and just because what we're trying to do, we're trying to empower people. One of the things I learned from Paulette is that, and we're going to get a doctor in a few weeks as well to talk about some of these things, because one of the things that in your case, Paulette, you felt the lump, then the lump went away, and then it, came back and stuff like that. But one of the things that we've learned in our interaction with other persons is that you don't necessarily have to feel a lump, because sometimes it can be within the tubes or whatever, it can be along that space, or sometimes it's more within the skin tissues, so you can actually feel that there is a lump there. Paulette, talk to us about during that time. Did you ever ask yourself, God, where are you? Why me? Because one of the things that we find when there's a diagnosis, it's actually like you go through that process of grieving, right? Or that process of coming to what we call an acknowledgement or terms with what is happening. So first of all, there is a lot of denial, then, you go through the different stages of acceptance, and then, just basically, okay, how do I cope? And there's anger involved. The 5 stages don't always fall together. Sometimes they overlap. So talk to us, Paulette, about your little, when you heard, I'll be like, where did he say? God, where are you? Why me?
All right. So when I found out I had it, I had stage 2 at the time, going into stage 3 breast cancer. What some persons don't understand is that it's a very aggressive thing.
Disease.
Yes, it's a very aggressive disease. So it might be stage 1 today, a couple more weeks from this, when you go back to check, it jumped to stage 2 or stage 4. But when I found out, tell her the truth, I didn't even I didn't even try to say to myself, say, Lord, all me I hear about cancer, it come on my doorstep. At the time when I found out that I had a cancer, I was indeed living for Christ. I was indeed a member of Worship and Faith International, which I still am. And I'm not going to lie to you, say that sometimes a little thought may not come across you and say, boy, look how God tell me, say, all right, him can do it for me. And him go over troubles and waters and valleys and mountains, and he can move everything. Him heal the woman or the issue of blood by just the woman touching the hem of his garment. What are you doing for me? But what I did is that I stood on the word, and I knew if I had to even take the breast off, my life is what is most important to me. A lot of persons would say, all right, sure, we can't live without the breast, or this, or that, or whatever. Listen, not because the breast is gone, that means that you're not complete.
So there's more to completion than breast.
So for me, God was in the midst, because what I do and what I use in that moment was prayer. To help me through it and to guide me through the steps, because I knew that at the time it would not have been easy. The many doctors, the many pills, the many things that I had to do, the eating habits I had to change, everything. Sometimes you look at yourself and you put on some clothes and you say, but no, never did look so in the clothes, or me look so now. No, you can't do that. Focus on getting better. Focus on the healing process, moving forward, so that you can step away from that and step into your purpose.
Exactly. All right, so let us just look on some facts about breast cancer. So breast cancer is more common, as we said, than we recognize. And that is something that the more you interact with people, you recognize, and that in of itself is what part of support provides. The support when you know of other survivors that have actually been through this. So are you a part of a support group?
Okay, I'm not a part of the support group, but what I notice is that, boy, the way I use my mouth to speak to people.
You're finding your own support group,
exactly.
Right?
So I'm wondering to myself, what is happening, because the way I talk to some people about some sickness that they have, I am saying to myself, it's like I'm in my own support group.
Right, or you're leading your own support group.
Leading my own support group, right.
Another thing that we know, so I want to establish 10 facts about breast cancer, is that ethnicity plays a role. It seems to affect in greater proportion a certain portion of the ethnicity than another portion. So more blacks are sent to be prone to cancer. Them said because we eat enough ackee, but I'm sure that's a myth.
Oh, Jesus.
It can be more than a lump. That's something that we established as well. Symptoms can be outside the breast, right? So one of the things I always say to people, I mean, we're also guilty of it, is that we need to know how our body looks normally.
Yes.
You know, just stand up, look at our bodies, and when we see protrusions or we see the breast looking a little bit different, as I said, I don't want to get too medical, but when we see like the breast, the skin of the breast looking very stretched, all right, and we know that normally, and husbands play a very good role too, because when you're used to the girls, you'll know when they're not as they're always shaped, or they might be out of alignment and so on. All right, so you know you want to look at that. You want to also look at the family history, because how many persons you said in your family, and that's one of the things that doctors ask us all the time. We probably think that them fussy, but the point of the matter is that there are a lot of things that are hereditary. They are part of our genes.
That's correct.
And we are not isolated people. We are part of a generation.
Yes.
So we need to investigate those things. How many persons you said in your family?
All right. So myself, my sister, my brother, and my uncle. But for me, I think that it's hereditary in my family. But what I just want to let people know is that do your test, do your self-exam as well. Don't be afraid to speak to your doctor. Listen to me. They say that sometimes the closest person to you is your doctor, is your friend and your confidant. Don't be afraid to ask questions. Things that you don't know, don't be afraid to go and Google it. Because for me, I asked him a lot of questions, things that I didn't know and wanted to know. When I sat with him at the table, if I see like he's going to say something to me and he hold back, I said, come on, doc, I'm ready. Give it to me. Because what I didn't want to happen to me is that I didn't want to see myself going back to UE to do another surgery. You understand? So do your test, women and men as well. Colon cancer is prevalent in men. I noticed that even with the colon cancer, men don't tend to do that a lot. They don't tend to go to the doctor and test that a lot. And that is very, very serious. Because I can tell you, my brother had colon cancer. And trust me, had he been doing some other things before, I'd have had my brother here. There's no test in the world that my sister did not do. There's no test in the world that she didn't do. Remember now, she was diagnosed when she was living in Venezuela. She had no family there. And this is when she come back to Jamaica. She took the breast off, took off piece of the kidney, took out the liver, took out the uterus. The stomach is what she could not have touched because the doctors told her that doing the surgery for the stomach, it would be a 50-50 chance for her.
Okay, okay. Oh, wow.
Yes.
Such a powerful survivor story. Right. So the other thing is that no risk factor doesn't mean no cancer. So sometimes it's just that you're the anomaly in your family.
Yes.
Screening recommendation. And one of the things I learned about is what is different from when you go to do the check versus the screening. So, you know, you go and check first, and once they find the cancer, they begin to screen, and then, you know, they get more details on it. Screening recommendation change according to your risk. All right. So it is advisable that, and a lot of people don't like the procedure because it's so. My producer is showing somebody showing the procedures in terms of testing, and I know people are saying, "Oh my God, this is so hot." It's so painful. Yes. But as the doctor said to us when we did a session together, is that it is best that you bear a little pain now. Yes. And get full understanding of what's happening to your body.
Most definitely.
And so on. Paulette, as we're about to wrap up, I mean, you know, Ansip and Chat this time runs so fast, right? But I just want, you know, a lot of people will to establish how important, as we close, the role of staying close to God in moments of adversity. Just talk to us a little bit about that as we wrap up.
All right. A lot of times we go through stuff, and sometimes we ask ourselves, where is God? He's right there. Prayer can change anything. Don't bother get up and say, all right, then, you know, I'm going to pray today, I'm going to pray tomorrow. Be consistent in what you're doing. And at the end of the day, you will in turn see the result. He said he will never carry you this far to leave you now. And I just want to encourage females out there that are going through this process. Again, it's not a death sentence. There's life after cancer. You can live. You can survive. Remember now, I thrive and I survive. Go out and get your checks done. Do your mammograms. Do your cervical test year in, year out. And don't be afraid to talk to your doctor. It's each one help the other.
Thank you so very much. As we close up, just want to remind you that there are some risk factors that you need to be mindful of. Drinking alcohol, reproductive history, taking hormones, right? A lot of people these days, they're doing all kind of talking here, injecting their body with all kinds of things. You want to understand as well that some of those things, they do have side effects, right? Because there are different types of silicones and so on that are being part of this whole breast lift and stuff like that. We also have to be very mindful of our weight and what we take into our body. As you said earlier on, sometimes it's what we eat. We are products of what we eat. And we all know that. Sometimes we eat some things and we can literally feel, you know, the excess on us. And there are times when we eat and we know that, boy, it don't even move a muscle because some things are more watery and more soluble than others. All right. And then finally, I want to encourage all of my viewers to be physically active. Women who are not physically active have a higher chance of getting breast cancer than others. So we continue to pray for you. 12 years as a survivor.
11 years.
11 years. We're speaking 12 into being.
Oh my God.
All right. God is good.
Amen.
All the time. So until we see you next time, we will continue to sip and chat. Have a good one. If you want to reach out to Paulette for support, our producer will also be able to provide that number. So as she said, she's forming her own support group as well by encouraging. That's also very powerful as well. So let me say thank you.